One of the things about Catholic healthcare is that we believe in whole person care, and a person isn't just a body. A person is a body, a mind, a soul, a spirit, and we want to take care of all of those aspects of the person when they come to us. And so spiritual care, our department really responds to the spirit. So our chaplains are there for a person's spirituality. Not everyone, believes in a religion or ascribes to a religion, but everyone is spiritual in some sense. And so we in spiritual care respond to that aspect of the person.
Our spiritual care program is fully developed because of how it was conceived by a faith-based body of sponsors. Here in the medical center and in our program in the Texas Division, we strive for high standards of care on all areas, including chaplaincy. For instance, all of our chaplains are board certified. That's a title that many people don't comprehend how hard that is. It takes slightly more than a master's degree effort to become board certified as a chaplain. And that's important to us because when we say that we want to bring that spiritual healing to the bedside, we put high marks on preparation. We have what's called clinical pastoral education.
Chaplains, the whole time that we're learning, we're really perfecting the art of pastoral conversation. Everyone who works at a hospital uses a tool, so the nurse might use a stethoscope and the surgeon might use a scalpel. The chaplain is always using our pastoral conversation. So we try to listen more than we ever open our mouths to talk, and that can be very difficult. So the art of pastoral conversation is a skill that we have to spend a long time learning.
In our department, me and my colleagues, what we want to achieve is, as our mission states, to make the healing presence of God known in our world. That's a big mission, and we truly believe in that. Our actions, what we do here, is informed by our religious faith, by our values and spirituality. By providing that spiritual care to our patients, our staff, for them to know that there's a chaplain available to them 24 hours. And for our patients, when they come to this hospital, for them to know that their spirituality will be honored. Somebody will listen to them non-judgmentally, not trying to offer any solution to what they're going through, but rather who can truly listen to them, who can walk with them as they walk through these difficult times in their lives.
So the role of the chaplain really is presence. We are present to people. And that really mirrors God's role in our lives in many times. When you're going through a difficult time, you feel lonely, you feel abandoned, you feel afraid, and God is always there, present. And the chaplain is present as a mirror of how God is in our lives. The role of the chaplain also is to engage the patient, the family, the staff member in conversation about their lives. We try to reflect the feelings that we hear in a patient's story.
What is most rewarding about this work is when people own their own ministry. When you sense that you have allowed for the conversation, the support, the understanding for a person to take whatever it is they're doing, and then it suddenly becomes ministerial because now they're doing it for someone besides themselves. They're doing it for the community, for love, for the sake of giving hope, for the sake of their God. These are the most rewarding things you can have in the work that we are doing. The job for a minister at that point is to get out of the way and stop.